Most of us have experienced trauma to a lesser or greater degree and have carried it with us for most of our lives. But dealing with it could be as easy as shaking it off. Given our turbulent history and the crime wave, many of our citizens have been affected by pain in one way or another. Trauma-releasing exercises were developed by Dr. David Bercelli as a way to reduce stress and tension within the body.
So neurologically, the person says, I feel calmer, and I don't know why.
Dr. Bercelli has a doctorate in social studies and began his career by doing lay missionary work for the Catholic Church. He's dedicated his life to helping people in conflict zones. During a bombing in Beirut in the late 80s, he took cover in a basement. What struck him in the life-threatening situation was that although the people he was hiding with all came from different countries and cultures, they all reacted in exactly the same way when the bombs struck nearby.
The body itself takes on a very natural behavior pattern when it's endangered. If people were frightened or threatened in some way, they would contract their body forward and they would pull themselves towards a fetal position, loud sounds, bombing, shootings, that sort of thing. And what I began to recognize is that it was a very common human pattern. So I not only saw it in the Middle East, I saw it in other countries where there were natural disasters or war.
Dr. Bercelli questioned that if humans were designed to endure and survive traumatic experiences, then there must be an innate way to release and resolve the tension that one feels in the body. He believed that if we did not have this ability, we would not have survived as a species. He set his mind to discover what the trigger was. So you noticed people's reactions in the bombings. How did these exercises come about as a result of that?
So I sort of played with my own experiences of tension patterns, and I had other colleagues that I was with, and I'd say, well, after this event that we just went through, where are you tight? Where are you stressed in your body? And so then we started to work with what muscle groups we discovered were tight. We ended up with 6 exercises, which are the fastest series of exercises to be able to get somebody to activate the tremor mechanism.
Dr. Bercelli has devised 6 exercises which induce a tremor mechanism in the body. He believes that the body's nervous system is designed to literally shake out the deep muscular tension and help the body return to its normal, relaxed state.
Okay, so just follow the energetic flow.
David, can you explain to us what happens in the brain during these tremors?
So that if my muscle tissue is tight like this, there is a neural pattern in the brain that's helping to keep that tightness there. Once that muscle begins to tremor, it begins to renegotiate the neural pattern, and it reestablishes another pattern. And that other neural pattern it reestablishes is the one to relax. So that just as the muscle tissue itself relaxes, the anxiety or the neural pattern that's creating anxiety in the brain through our thought and our excessive ruminating in our minds, that also begins to relax, and then the neurophysiological pattern both together set themselves down into a calm state.
During my second tour, I received serious injuries Christmas Day due to a suicide bomber.
Adam McCabe served for 2 terms in Iraq in the Marine Corps. Like most soldiers, he was deeply affected by his experiences of war. On returning home, he was diagnosed with severe post-traumatic stress disorder.
I was so hurt. I was in such a dark spot. But I heard everyone around me. I heard the people that were closest to me, the people that I loved the most.
The United States Defense Force is using Dr. Bercelli's techniques to help their soldiers when they return from Iraq.
I guess the hardest part for me was asking for help. Having to relive my story and talk of the things that were so tough for me to think about.
I don't want to approach men, and certainly not soldiers, at the very beginning to say, tell me what happened to you in Iraq or Afghanistan. That's the worst thing to do to them because the charge is too high. But I've had many soldiers lay on the floor, tremor, go into a relaxed state, and they actually then offer me the story, saying, you know what the worst thing was? What's the difference there? I reduced the anxiety level. Now they can talk about it. And because they can now talk about it, they can integrate that story into their life, and then the trauma is released.
I can tell you, after the first day of a 3-day workshop, I slept that night, which may not sound much, may not sound like a whole lot to you, but to me it's a pretty big deal.
The beauty of these exercises, Dr. Bocelli believes, is that they deal with neurology, not psychology, and one does not have to emotionally revisit traumatic events from the past.
So the tremor mechanism is only concerned with how does the brain neurologically process it. It doesn't care at all about what the content of it is. That's why it could be early childhood, or it could be having been mugged 2 days ago. Both of those are neurological patterns in the brain, and that's all we're working in this, is the neural network and not the psychological component of the story.
Dr. Bocelli has taught the technique all over the world, including South Africa, and while most of his patients have a drop in anxiety, he stresses that more research needs to be done to ascertain the long-term effects. Now, in terms of the results of the trials of the Iraqi soldiers, what are you finding so far?
The results are far higher than ever anticipated. They're extremely favorable. So there's a real strong suggestion already from the data that this has been very, very well received by the soldiers, used by the soldiers, and has really good results from the soldiers.
And if those results are anything to go by, then there is hope for the rest of us, that through these exercises one can achieve not only a greater sense of calm, but a sense of well-being.